Hello, my name is Chariya and my partner is Barbara, and today we are going to be talking about lung cancer. So, in our presentation, we're going to be going over pathophysiology, types, causes and risk factors, current research, signs and symptoms, treatment options, prevention, and then we will conclude our presentation. Okay. So, lung cancer is a disease caused by uncontrolled cell division in the lungs, a malignant disease that develops in the lungs when cells in the lung tissue grow and divide uncontrollably. Cells usually divide as a normal function, however, mutations can occur. And when they are damaged, they create masses or tumors. Lung cancer is the leading cause of cancer deaths in the world. It is one of the most aggressive forms of cancer. So, this is just a basic lung anatomy. The lungs are separated into a section called lobes. The right lung has 3 lobes and the left lung has 2 lobes. Upon inhalation, air enters through the mouth and nose and enters the lung through the trachea. The bronchi enters the lungs and into smaller branches called bronchioles. At the end of the bronchiole are tiny air sacs called alveoli. These alveoli absorb oxygen from the air and remove carbon dioxide from blood upon exhalation. Absorbing oxygen and eliminating carbon dioxide is the essential function of the lung. The pleura is a thin layer surrounding the lungs that protect it. The diaphragm separates the chest from the abdomen and forces air in and out of the lungs. So now we are going to be getting into pathophysiology of lung cancer. As I said in the intro, lung cancer is due to cellular damage and mutations. Lung cancer begins when lung cells accumulate damage to the DNA. The most common reason a patient may get damage to the DNA of the cells is through carcinogens such as cigarette smoke. So, getting more into pathophysiology, cellular mutation. Normal bronchial epithelial cells undergo genetic damage from carcinogens. Not only do carcinogens come from things like cigarettes or tobacco, they also come from radon or asbestos. Oncogene activation and tumor suppressor gene inactivation leads to loss of normal cell control. Uncontrolled proliferation is when abnormal cells grow rapidly and invade apoptosis, which is cell death. Angiogenesis is when tumor cells stimulate new blood vessel formation to support growth. Invasion of local tissue. Tumor extends into nearby bronchi, lung, parenchyma, and pleura. And then metastasis there is metastasis via lymphatics and bloodstream. The most common sites of metastasis are brain, bones, liver, and adrenal glands. So now we're going to get into the types of lung cancer. There's non-small cell lung cancer, which has slower progression and accounts for 85% of cases. And there's small cell lung cancer, which is highly aggressive, oftentimes has early metastasis, and accounts for 15% of cases. One thing to remember is small cell lung cancer is almost always associated with cigarette smoking. Non-small cell lung cancer is more common. This type of cancer usually grows and spreads to other parts of the body more slowly than small cell lung cancer does. There are 3 different types of non-small lung cancer. Adenocarcinoma This form is often found in the outer area of the lung. It develops in the cells of epithelial tissues, which line the cavities and surface of the body and form glands. Squamous cell carcinoma is a form usually found in the center of the lung next to the bronchus. And large cell carcinoma is the form of NSCLC that can occur in any part of the lung and tends to grow and spread faster than adenocarcinoma or squamous cell carcinoma. For small cell lung cancer, it's highly aggressive with rapid progression. The metastasis is early and widespread, especially to the brain, the bone, liver, and adrenal glands. It is very fast growing versus non-small cell lung cancer. So now we're going to get into the causes and risk factors for lung cancer. Smoking, secondhand smoke, asbestos and radon, air pollution or occupational exposure, family history, history of lung infections, poor diet and physical activity can be some risk factors for developing lung cancer. Smoking accounts for 85 to 90% of all lung cancer cases. For genetics and family history of lung cancer may increase risks, and certain inherited gene mutations can predispose individuals. For environmental and occupational exposures, radon gas is a naturally occurring radioactive gas found in homes and buildings. Asbestos is found in construction, shipyard, and is common for industrial workers. Arsenic, diesel exhaust, and other industrial chemicals, and air pollution, especially long-term exposure, can also put someone at risk. Occupational risk factors, jobs in mining, welding, painting, or construction can put someone at risk, and exposure to radiation or chemical carcinogens. And African American men have a higher incidence than white men for developing lung cancer, and also pre-existing lung diseases such as COPD and pulmonary fibrosis can put someone at risk. Tuberculosis can also put someone at risk too. Poor diet, alcohol use, or lack of physical activity may contribute. And of course, smoking will also really increase the risk. So, some current research that we pulled from the CDC is lung cancer is the third most common cancer according to the CDC. More people die from lung cancer than any other cancer in the U.S. Based on the most recent data available, 218,000 new lung cancers were reported in the U.S. Men die from lung cancer more commonly from women, or they had higher rates, And I got this pie chart from the CDC website. From 2018 to 2022, nearly half of all lung cancers were diagnosed at a distant stage. This means that the cancer had spread from the lungs to other parts of the body. 1/4 of lung cancers were found at a localized stage, which means like the cancer stayed in the lungs, and less than 1/4 remained at the regional stage. So the lungs spread to nearby lymph nodes, tissues, or organs.
Hi, my name is Barbie, and we are talking about lung cancer today. And right now, I'm going to go over symptoms. Symptoms for lung cancer can be anywhere from short of breath, hoarseness in the voice, coughing up blood or bloody tinged sputum, chest pain, a new cough that just doesn't go away, or wheezing. And there are some symptoms that will appear when cancer has spread to other parts of your body, like bone pain, headaches, loss of appetite, weight loss, and swelling in the neck or face. Hi, okay, I'm going to be talking about treatment options for lung cancer. And the first one is surgery. There are different types of surgery options. A wedge resection that will remove a small portion, a small section of the lung. A segmental resection, which removes a large portion of the lung. A lobectomy to take out just an entire lobe of the lung. A pneumoectomy, which removes an entire lung. What usually follows after surgery will be chemotherapy quite often, where it is used with chemicals, strong chemicals, to help kill off the cells that remained after the surgery and removal of the cancerous tissue. Other options are radiation therapy, which uses powerful energy beams, immunotherapy, which helps the body immune system to help kill the cancer cells. There's also palliative care options, which is built in to help patients with a serious illness, and that there are treatment options that they can use also to make you feel better. All right, we're going to be talking about preventions of lung cancer. While there's no way to actually prevent it, you can reduce your risk. First off, by not smoking. Avoiding secondhand smoke when you can. If you're already smoking, stop smoking at the soonest possible point. You can have your home tested for radon. You can avoid carcinogens at work. And you can eat a diet full of fresh fruits and vegetables. And it's always recommended to work out most days of the week. All right, in conclusion, for lung cancer, early detection is key. While most people don't exhibit symptoms outwardly until they're closer to stage 3 or 4, by taking the preventative measures of not smoking, not being around secondhand smoke, trying to live a healthy lifestyle, is your best option to try to prevent you from developing this disease.